Carrie. I'm the stroke coordinator here at Orange County Global, and we are partnering with Care Ambulance to bring you a stroke education series direct to you in the field.
My name is Dr. John Chen here. I'm the medical stroke director for KPC Health here in Orange County, including all 4 of our hospitals.
So we're going to be breaking down the BFAST, signs and symptoms of stroke. So we're going to start with the letter B.
So part of B, or testing for balance, is seeing whether or not a patient can maintain posture without falling over. So if you have a patient that's standing, very often what we would have is have Carrie demonstrate as to how we would test for balance. You'll have them put their feet together and close their eyes. Now, if they don't have balance, the patient will then subsequently fall over. Now go ahead and open your eyes for me. So she's maintaining perfect posture at this point in time. Now another thing that we can test for balance and for posture and for the signs that we look for stroke is whether or not they can touch their finger to their nose. So go ahead, bring your arms up here. Take this index finger, touch your nose. Take this index finger, touch your nose. Now if a patient has problems with stroke, they're not going to be able to do that by touching their nose. The second part of the BFAST is E, standing for eyes. Now, there are 2 ways of testing for eye problems for stroke. So there are 2 things that we're going to be looking for. First of all, whether or not there's going to be a loss of vision. So very easily that could be accomplished by showing fingers and asking the patient whether or not, do you see my fingers here? How many are you counting
2.
at this point? How about now, are you counting?
2.
Okay, so that gives you an idea as to whether or not the patient lost vision in either eye. Now the second thing is a little more sophisticated, is you're looking for what we call a visual field cut. And what that point is that you're trying to see whether or not they can see the peripheral part of the vision. And that point involves the patient looking at your nose and then me flashing my fingers on the side and basically saying, okay, which finger is moving? And you'll have the patient point to that finger.
The right.
How about now? Okay. Now, another component that's important for testing for eye is seeing whether or not the eyes move in a concentric manner. So you can have the patient look at your finger as it goes across the field to see whether or not that eye is tracking. Those eyes are tracking your finger as you go across. Now, if you have a stroke, in certain parts, certain strokes, you're going to have eye movement problems, like the eyes will not be falling at the same time, or they're skewed in a different direction. These are all very important signs for E. The third component of the BFAST is, of course, face. Now, face is something that is really easy to observe. First of all, you have the patient in front of you. Go ahead and turn right here. And what you would very easily see is whether or not there's asymmetries between the right and left side of the eyes, whether or not there is a loss of the epicanthe that folds around the lips. Very quickly, you can assess whether or not there's asymmetries. Now, most of us also have some asymmetries at baseline. Sometimes you can obtain a driver's license or other identification. You can compare the picture on that to what we are seeing in front of us. Now, testing for facial weakness is also relatively easy. 2 things that you can basically do very quickly is have them make basically blow out their cheeks or smile. So go ahead and give me a smile. So you can see a smile here. Basically, the corners of the mouth go up symmetrically, or puff out your cheeks for me. And you can see symmetric. And sometimes you can go ahead and try to push and see whether or not there's any weakness. And the other component is go ahead and close your eyes. And again, you can see that the folds when you close your eyes seem to be symmetric at this point in time. The fourth component of the BFAST is testing for arm strength. Now, arm strength could be very subtle or it could be very apparent. For example, if the patient is not able to lift their arm at all, you can see their arm is flail. They can't get their arm up other than maybe a little bit of a shoulder shrug. But if it's subtle weakness, what we're looking for is basically pronation. So what we would have is the patient in field will ask them to extend their arms fully straight ahead. Now, if there's subtle weakness, what you're going to see is you're going to see a slight in-turning of the hand that's weak and dropping of the hand. Now, that could signify a stroke that is very subtle with subtle weakness. The next component of the BFAST protocol is basically speech. Now, speech can be divided into 2 different things, whether or not you can speak physically or whether or not you can recognize certain items presented in front of you. And a very quick assessment in the field is whether or not the patient can identify things shown to him or her. And basically you can use objects that are on you or very near you, including how many fingers I'm holding up, what's this called, what is this, what color is that, or if you have a cell phone, you can ask them, what is this, or whether or not you have a pen on you, what is this, what do you do with that? Now, if the patient is not able to identify any of those items, then you think there's going to be a problem with that part of the brain. So again, that could indicate a stroke. Another important component of speech is basically dysarthria or slurring of the speech. Sometimes that could be mistaken for inebriation, but it's also very important to recognize if someone is having that slurred speech, that could also be a very important component of stroke. If you have one or any or all of these symptoms, it could be indicative of a stroke.
And that brings us to the final component of our series, T. It's time to call 911. Get your patients to the stroke center immediately.
For every minute of delay, there's roughly 2 million brain cells that die off. So time is brain, time is of essence.
And we want to thank our EMS and first responders. From our KPC family to yours, have a safe day.
Thank you very much.